what is Molomics?
So Molomics' objective is to cure diseases, and this is a very difficult task to do. And we strongly believe that when you connect artificial intelligence with human intelligence, you can actually create new types of cures and medicine. And that's really what we get up for every day.
Okay. And so when you say you connect human to artificial intelligence, you mean that there are things that humans do better maybe than machines?
Exactly. Or maybe not better, but they're very complementary. They're things what machines can do. I mean, at the end, a machine is somehow trained on human ideas or data sets, but we really believe that the human mind is very special and can solve problems differently than artificial intelligence. And this is why we strongly believe that when you connect these two systems, we can get to new types of cures.
Okay. And then the name for that human collaborative intelligence in this setup is gamification, right?
Exactly. That's the way how we do it at the end of the day. Because of course it's extremely challenging to motivate a human to put his ideas and logic into a problem. So the challenge is really, how can you stimulate a person to help in this process to create new drugs? And that's where gamification comes in. So if you give a human an interesting puzzle or other gaming challenge where he has to think a little bit, and trying to resolve problems, then you can really stimulate him to add his intelligence to the system. And that's why we use gamification to get to our objective at the end of the day.
Did you get any inspiration for gamification from other experiments like Foldit, or is it similar in any way to Foldit?
Yes, I mean at the beginning this was clearly one, as you said, Foldit especially was one game which kind of got us thinking if we can also apply this in drug discovery. And especially the game Foldit, as you mentioned, it's also trying to really harvest the intelligence of the human to resolve this problem. So yes, this was one reason why we got into the gamification, but also some of our founders had worked in computational drug design for a while, and we thought that there's something missing. It seems like that computational drug design got to a point, and a lot of people had much more expectation that we can actually really resolve the problems in the computer, but it got somehow stuck at one point, and so we thought, you have to rethink the problem, and that's where we got to the idea of include better the human people into the design process and not focus only on the computers. So we think that also, for example, different to Foldit, that for gamification you have to use new technologies, and what we're talking about is mobile technologies, and that means that we are really trying to bring the drug discovery process on mobile platforms. And this is where a lot of our innovation is going on, to understand how you can actually run complicated calculations on mobile devices. How can you stimulate people to act in the science without really knowing it, but having fun and enjoying these circumstances. What we really pretend to do is to discover small molecules which are not only hits, but they are, let's say, lead candidates. That means these are small molecules which have many pharmacological properties already optimized. So we don't go only for the activity. No, when we do a gamification drug discovery project, we want to make sure that, for example, in case of a Parkinson drug, which we're working on, that the small molecule already is predicted to pass well the blood-brain barrier, but we also want to make sure that there are no cardiotoxic effects, there are no liver toxicities. So we are really trying to integrate, to say the whole human body is exaggerated, but we really want to address from the beginning that the small molecules have all positive properties, at least predicted in the computer. And then once we have these candidates, we really bring them to the laboratory, synthesize them, test them. And that's why I think we get at the end, let's say, to our leads in a different way, which is not basically directly connected. It's faster, or we make the drug discovery process shorter, or we don't like to think about that. We really think that we can in this way create safer drugs and better drugs, because we want to cure diseases. So of course we do a lot of programming, for which we use basically laptops. Okay, I mean, you can use whichever type you like. I mean, you're not restricted to Windows or Mac or open source Ubuntu. But this is where really our core lays, that we have computers, and all the serious calculations, we do everything in the cloud. So basically we use Amazon, and this is one important part of our technology. So we run all the calculations on the cloud, meaning it doesn't matter if we have 1 million gamers or if we have 10 gamers, right? This is really a great advantage with the new mobile technology, that you can just unfold calculations and have a lot of them running. So this is principally what we're using. And then we use, of course, many type of project organization tools, like for example Trello, which is very important, I think, in industry, but I think also academic environments should start using them, because you have to have your projects very organized, know what your objective is, and have the team work together. And with these project management tools as Trello, where you can define every task, you can really make big projects work. So the plan is to do it at the end of this year. Right now we're already in the testing phase, so we are already creating molecules with a small group of gamers, and we hope to have the game ready for a real worldwide drug discovery project, the first one in the world, at the end of the year, probably October, November.
Okay, so good luck and thank you, Jascha.
Thank you, Jerry.